Like every year during the EBMT 2023 Annual Congress, we have two major awards. We have the Bekkum Award, and it's mainly given to a key practice-changing clinical work. And this year we had a fantastic randomized phase 3 trial looking into the role of Vedolizumab into GvHD prophylaxis. And this phase 3 international randomized trial could show that Vedolizumab can be an excellent agent to prevent GvHD. And this is extremely important because if you look in the last 20 or 30 years, actually, this is for the first time that we have an agent which is effective in terms of GvHD prevention. The other award we have every year during EBMT is a Basic Science or Translational Science Award. And this year it was about the broader domain of microbiota modulation. And actually the whole story started with the diversity of the microbiota. And it was shown now since more than 10 years that those patients with a low diversity microbiota, when they receive a transplant, are going to experience a lower outcome. Their outcome when it comes to GvHD, when it comes to different complications, are not very good compared to those patients with a high diversity microbiota. But then the big question is how to explain this. And in this work that was given the Basic Research Award and that was featured actually in the EBMT newsletter that you can see on the EBMT website, actually the authors, the investigators, looks into actually the metabolites, and they could find that actually this low diversity is in relation with the absence of certain mandatory or very important metabolites, which are very crucial in this setting. So this will open again, will pave the way for different interventions in order to improve the outcome of patients with low diversity, either through fecal microbiota transplantation, and there are some nice ongoing trials. And in this Congress, there are several oral sessions dedicated and showing the benefit of FMT in different situations, especially refractory acute GvHD. And this will be presented by Professor Malar, but we have also a nice session, educational session, presented by Dr. Batibaglia. But also the other pathway or the way to modulate and improve the outcome of the low diversity would be around creating or making specific consortia that are able to fulfill the need of these metabolites. So it's a totally new frontier in medicine, in my opinion, and this will definitely, I think, again, I'm a believer in this field of microbiota, and this will definitely contribute to further advancing the hematology field, but also, I think, the broader field of cancer. And all of this is about increasing the survival of patients, but also decreasing the incidence of some deleterious complications.